Oh, thank you. Is our pharmacy career pathway panel. And so we have we have three individuals who are joining us today. We've got Giselle Copa, who is a pharmacy technician student who recently graduated from Austin Community College. We also have Alexis Martinez, who is a pharmacy program director with the Central Texas Allied Health Institute. And finally, we have Stephanie Obilome, who is a pharmacist with Walmart in the Houston area, and she is an Austin native. And Stephanie will be joining us around 11 a.m. So we will get started just with Giselle and Elexis for the time being. And then once Stephanie is able to join us, we'll bring her into the panel discussion. Oh, I think I see another Q&A. So I'll just answer this really quickly before we move on. Oh, thank you, Giselle. If you could answer that, that would be great. Majoring in biology, that's a good question. All right, so I will give Alexis and Giselle a moment. If you would like to enable your video and say hello, we can get started. Hi, Giselle. Oh, yes. Hi, Giselle. Hi, Alexis.
Hi.
Glad y'all were able to figure that out. Okay, wonderful. Well, yeah, would you both like to speak briefly about your educational background and your current place of work, please?
Yeah, so I am a recent graduate from Austin Community College. I'm 20 years old, and I kind of took a year off high school to kind of figure out what it was that I wanted to do. Started taking prerequisites to transfer to a university. And I found the pharmacy tech program and I was like, why not? Let's try it out. I'm interested in pharmacy. And I really enjoyed it. We did a lot of hands-on training as well as the lecture sort of training. We did a rotation at a retail community pharmacy as well as a hospital rotation. So we kind of got to see like the best of both worlds and kind of go a little more in depth of where you want to go after you get licensed as a pharmacy tech. So they did a really good job of training us in both settings. So I feel like I'm pretty prepared for whatever pharmacy throws at me. So yeah, right now I'm working at a spin studio. So I haven't gotten to work in a pharmacy yet as a pharmacy tech, but hopefully tomorrow I'm taking my test. So hopefully that'll change.
Great. Thanks, Giselle. And just curious, did you go to school? Are you from the Austin area?
I am actually from San Antonio, but I moved to Austin about 8-9 years ago. So I've been here for a while.
Great. Thanks.
Hi, everyone. Well, I actually got my education in San Antonio. So I'm a graduate from Brown Mackie College. I currently work at the Central Texas Allied Health Institute. How I came about my education, I've been in HOSA since I was like in 8th grade. And Lehman High School, I actually graduated from. So here in Kyle, Texas, close to Austin. I actually had a pharmacy tech program before 2020, where all you had to do was have your high school diploma. And during that time, I was able to concentrate on just my pharmacy technician my senior year. And I didn't test during that time. I took about a year off, just like Miss Gazelle, just to kind of figure out what I wanted to do after high school. And I just generally graduated back into pharmacy tech, where I got my associate's degree and worked really hard in lots of different fields of pharmacy technician for about 10 to 11 years until I landed this job.
Great. Thanks so much, Alexis. Well, we're really excited to have your expertise and your experience. You'll be able to talk about a lot of different scenarios in which you've been working as a pharmacy tech. So appreciate your time today. Wonderful. Well, as I mentioned, we have another panelist who'll be joining us in a moment, so we can check in with her about her educational background and her current place of work when she's able to get on the line around 11. So the next question pertains to the daily job duties of a pharmacy technician and pharmacist. And really, I think the big question is, how have the job responsibilities changed due to COVID-19? And then what are the updated health and safety practices that are being implemented at this time, because we know that COVID, there's so many innovations, new vaccines and new medications that are kind of coming online to assist patients as they're or trying to protect themselves against COVID or recover from COVID. So I know that Elexis, in your role as the program director, could you speak about some of the content that y'all have incorporated into your training, if anything?
So we definitely focus more on sterilization and patient safety, a lot more in our courses to be implemented. Also, we are right now in progress of discussing of trying to implement a class for advanced technician, or for technicians who already have their PTCB, for advancement classes, so they can either get immunization certified or nationally IV compounding certified.
Great. So it sounds like sterilization and making sure everything is very clean is the primary, a huge goal now. Yeah. And as far as daily job duties go, I want to open this up both to Elexis and Giselle. Could you speak about that and kind of what are the expectations, especially for students as they're thinking about pharmacy technician as a career pathway? What should they expect once they get into the field?
Yeah, so as a student, since we were able to have that kind of hands-on experience, at the retail setting, it's mostly like filling prescriptions and just counting out those pills, or if it's a liquid, pouring it in the bottle and putting the sticker on and everything. My community setting was fairly small, so there wasn't really any room to do much other than filling. But at the hospital, it's a lot more running around the hospital. They have those ADMs, the automatic dispensing machines. You kind of go around the hospital and refill those. You're able to be in the IV room, compounding medications for patients, and then delivering those. So yeah, it's a lot of different experience, completely different experience, but it was really awesome to kind of see both sides.
That's great. So it sounds like it really depends on the setting that you're in, and it might be very different in a hospital setting versus in a smaller retail setting such as Walgreens or CVS or even HEBs. That's interesting. It sounds like you mentioned there's a lot of running around. So is it a job where you're on your feet a lot and moving around a lot?
Definitely invest in some really nice shoes for sure. I did.
Sure. Yes.
Yeah.
I would have to agree with Ms. Copa. Retail pharmacy, I've worked in small and big, so it's definitely utilizing insurance, billing, making sure the labels that you're inputting into the prescription is correct. You're definitely multitasking a lot compared to being in the hospital field. In retail, you never know what situation that's going to come about. While in hospital, you have your regular daily tasks. And if you're a compounding technician, then you kind of have to really deal with the surprise prescriptions, such as for emergency rooms and for IVs, compounding neonatal prescriptions and things like that. Definitely as far as a unit, we like to say scope of practice. So as scope of practice as a pharmacy technician, you're always going to be filling medications. You're always going to be messing with insurance, non-sterile and aseptic technique for compoundings. Those will be your basic job duties every day. Then you have our scope of practice. Then you have your organizational job duties, where your organization tells you what you can and cannot do, because there is a broad job duties that pharmacy technicians that have their education can do, and it's just advancing more every year.
Yeah, and I definitely want to add to like the retail setting is a lot more customer service facing, while hospital setting is a lot more like she was saying, you know, you have your daily duties and you're not really interacting with patients as much as you would in a retail setting.
Gotcha. That makes sense. Thank you. Hi, good morning, Stephanie. Thank you so much for joining us today. We've got our third panelist on the call now, joining us from her vacation, so we really appreciate it. This is Stephanie Obilome. She is a pharmacist with Walmart from the Houston area, and as I mentioned, you are a Austin native, I believe, so appreciate you joining us. And you know, we're really just kicking off our panel right now. So if you want to quickly take a moment to introduce yourself, Stephanie, and we can kind of get into the question 2, which is kind of what the daily job duties are like.
Yes. So, hi, everybody. My name is Stephanie Obilum. I'm from Austin. I'm currently practicing as a pharmacist in Houston with Walmart. I'm a traveling pharmacist, and my main job is doing the COVID immunizations, running the clinics there pretty much every day. And then some days, couple days a week, I'll be in the pharmacy doing all the nitty gritty stuff. Nice to see everybody.
Great, thank you. And do you mind just briefly mentioning where you went to school and how you got to become a pharmacist?
For sure. Yeah. So I actually graduated from Texas A&M College of Pharmacy in 2020. So I am a very fresh new grad. Um, the journey of that whole thing was a lot. I'm sure you guys have kind of talked about it, especially the tech journey and the educational background is somewhat the same. I got my bachelor's at LSU, and then I went to do my doctor of pharmacy at Texas A&M. And so now I'm here as a new grad working during the times of COVID. So it's my perspective.
Yeah, well, as another LSU alumni, go Tigers, and thank you for joining us. Appreciate it. So yeah, you touched a little bit on your daily job duties, and sounds like you're working a lot, you know, on the front lines, getting people vaccinated for COVID. Could you touch briefly on some of the health and safety practices that you utilize on a daily basis?
Yeah. So on a daily basis, a lot of our practices they've tried to integrate it into like the systems for COVID. So mainly, you know, getting everybody's like, well, I guess starting with like PPE, like mask up, double mask, face shield. They've kind of changed the precautions and how they're doing it now. So Texas is kind of giving everybody leeway for the masks now. So it's changing. It's just so wild. Everything's changing so quickly. So we still do, you know, masks to get the COVID vaccination, and the screening process is still the same. We're asking them, you know, a bunch of questions. Who have you been in contact with? Making sure that everything's sanitized. So I work really closely with associates there at the Walmart to like help me sanitize after every patient. We just recently got the Pfizer vaccine. We've been doing Moderna, and those precautions are a little bit different. Those screening questions are a little bit different. So it's been a challenge to kind of shift and be flexible and be adaptable in this time and space with COVID. But I do appreciate getting to still interact with the patients and getting to, you know, have that little bit of, you know, I like talking to the patients. I like having that little bit of just interaction, communication. You know, COVID, we were all bound to our homes. And so now it's like, wow, I get to talk to hundreds of people every day and vaccinate hundreds of people every day, and still try to remain safe and do my job at the same time. So it's a challenge, but it's great. I really like it.
Great, thank you for sharing. And it sounds, it echoes what Alexis and Giselle were speaking about a moment ago. It's, very, I guess, a social job. It sounds like you're on your feet a lot with pharmacy technicians as well as pharmacists interacting with customers. So if you have a energetic and outgoing personality, it sounds like it might be a good fit, good personality fit. So,
100%.
yeah. Great. I see that we have a quick question. Thanks, Lauren. So she's assuming because of COVID, your job became more stressful, but before COVID, was it a very stressful job? I think this question can be answered by everybody if you have a quick moment. Alexis, Giselle, Stephanie.
That's kind of hard because there's so many different fields I believe that I worked in. It really is just a matter of how you view it. I found retail to be very stressful for me, while working in insurance and hospital was those daily duties seemed less stressful. Even during COVID, it's been about the same for me as far as being in the back end and being in the front lines. Retail was always stressful for me.
Yeah, I agree. It was a little bit more, I can only kind of compare it to when I was interning as a fourth year pharmacy student. And it was stressful. It was, I think now it's more of like, we have a strict amount of doses that we need to get done. We have this many vials that we need to do today. So it's a little bit more stressful in a sense, but if, like you said, Leslie, if you have that personality, that high energy, then you can adapt and be flexible.
Great. Thank you for sharing that perspective, all of you. All right, well, I will move on to question 3 then, if there aren't any other questions. Let's see. So I know that there are quite a few educators and high school students on the call today. So this question is for everyone. What advice would you give to high school students to prepare for a career as a pharmacy technician or a pharmacist? And if you could just think about some of the experiences that have led you to where you are today, and if you're comfortable sharing, we'd really appreciate that.
Well, I can go first. Throwing it back to high school, sometime far, far away in my mind. I was definitely taking dual course. I think that's what it was called, where you're doing like your
Credit?
Yeah, dual credit. That's exactly what it was. So I was taking like anatomy and physiology, and chemistries and physics. I think that would be the best course if you see yourself going into healthcare. Very much helpful for if you are going to continue into a associate's degree or bachelor's degree. I would think if you're in high school, you should kind of start with those. I don't know if they still do AP courses, but that and dual credit at your local community college. It's very simple, and those educators are really, really, like, they're very hands-on. It's a little bit different when you go into like 4-year college. You don't really get that intimacy with the educators as much. It's a little bit harder because the classes are bigger. So I would suggest maybe getting into those dual credit anatomy, physiology specifically.
Great. Thank you for that. That's really good. Yeah, it looks like somebody had a question. So focus more on science. It sounds like any sort of science classes you can take in high school will be very beneficial. Giselle, I know you recently graduated from your pharmacy tech program. Do you have any perspective?
Yeah. To piggyback off of what Stephanie was saying, the dual credit definitely would help. Maybe if you have like a on-ramps, which is the UT high school credit, or if there's any ACC dual credits, those will count. The AP test, let's say you fail the AP test, you don't get the college credit. So it's kind of like hit or miss with the APs. But with the dual credit, you'll still get the credit even if you get like a C or something. It still counts towards your college career. Also for pharmacy tech, at least at ACC, you didn't have to take any prerequisites for this particular program, so that was super helpful. But if you wanted to advance, definitely take those like chemistry. What I did is I took the classes that I didn't like the most first. So I started off with chemistry. I'm a little bit not the greatest at chemistry. I started off with that. And then you can slowly get into those courses that you are more familiar with and enjoy more, which definitely helped me out a lot.
You probably have more motivation to take the harder classes when you're just starting out too.
Sure.
So yeah, that's a good point. Alexis, do you have any feedback on that?
Well, I guess I was kind of different than Miss Gazelle and Miss Stephanie. The only AP class I took was English, and as far as I did have a dual credit, but it was because I did health class since I was in 8th grade. What really helped me was doing HOSA. It helped me because it was a lot of patient focused, pretty much like a CNA, MA. I even did some competitions and really got the feel of what that type of healthcare field can do. I did want to help people, but I learned very quickly that doing that much hands-on with the patient was not for me. I wanted to be the back end stage, and senior year pharmacy technician was a class that popped up. And instead of me just not taking a class, because I had so many credits in health that I was able to just not take it my senior year and have a free class, I decided to take the pharmacy technician, and it was just a disc at the time. This was way before 2020 again. So you were able to just sit for the exam after you watched a disc for like 20 hours. And I just didn't feel comfortable taking the test at the time. And so I would definitely tell high school students, if anything, try out HOSA, because at least you can figure out what you really want to do. And that's pretty much my experience of how I kind of got into pharmacy technician today, realizing I wasn't nurse material and I wanted to be a pharmacy technician just to help out patients and get that feel of being included in a team.
Great, thank you for sharing. And especially HOSA, I think that's something that many schools offer. So that's something that's very accessible to a lot of students in our region and even on a larger scale beyond our Travis County, Central Texas area. So perfect. Thank you so much for that perspective. All right, well, we'll move on to question 4, which is, again, speaking to educators and high school students, what would you say are the top 3 skills needed? And you've already spoken about some of the courses that you recommend students taking in high school. So if you want to talk about anything that you didn't mention in the previous question, but I think definitely the top 3 skills or top skills that you think are needed to succeed as a pharmacy technician and a pharmacist.
I would say as far as soft skills, because we can always find skills that need to be learned, such as textbook and stuff. My top 3 soft skills going into pharmacy for high school students, I would say would be adaptability. Make sure you're adaptable. There's so many opportunities in the pharmacy technician. You just have to be ready to learn and fail. Next, what I would say be communication. There's so much communication that goes on. A simple, I forgot, can actually hurt a patient. So communication is very key. And I would say last but not least would be determination and flexibility. Those 2 together would definitely help you succeed as an advanced pharmacy technician and just not a technician. Having those 3 skills can definitely put you apart from other technicians.
Yeah, I definitely agree with Alexis, especially on the adaptability. You just have to be able to do the shift. It might be many shifts in a span of 10 minutes, but you got to do it, Um, being detail oriented is a really, really great skill to have. Um, having your just It's funny because I would say short-term memory, but also, for if you want to take it all the way to um, pharmacists, then you have to have long-term memory. But short-term in terms of when you're on the workflow, when you're on the bench in the pharmacy, you got to be quick, you got to be detail oriented, and you have to be efficient. Um, and and if you don't have those skills, I mean, you can definitely learn them with time and experience, but going into a program having those skills, um, you'll be great.
Thank you. Giselle, did you have anything to add to from your perspective?
Yeah, maybe just to add on to all those really great skills, maybe I think I would say really having that compassion and empathy, thinking about the patients. For example, if you're feeling a little bit lazy one day and you're like, oh, I think I counted, a little more than 30 pills, but I'm not going to recount because, I'm feeling lazy. It's like really thinking about how much you can affect the patient, just by doing that little mistake and being lazy that day. So definitely have that compassion and empathy. You never know, what your patient is going through. So definitely having that too would definitely set you apart.
Thank you. Yeah, that definitely echoes what Alexa said. Like, this really affects the patients, their lives, and you have to keep that, in mind at all times. It seems like it's so important that you accurately measure everything. And adaptability, I feel like y'all are probably really living that right now with COVID, but it's always being adaptable. So thank you for that. Okay, so the last question that we have, and I think that you touched on this a lot in the previous question with the skills, but when you do work in a high volume pharmacy, you all have spoken a lot about the fast paced environment, especially like in retail or hospital setting. How do you make sure that you're providing excellent customer service and also really being detail oriented and making sure you're checking prescriptions and checking the dosage and things like that? How do you kind of prepare yourself for all of those things that are coming at you at once?
I would say, at least when I was in field, having a good teamwork, helping delegate tasks, really helped with customer service. If we were all working together and one person couldn't finish a task, grabbing my next technician and asking, hey, I can grab the front counter if you can finish filling this prescription for me. Here's if you could scan the barcode. Really helped providing that front service. And as far as excelling in patient care and prevention fraud for prescriptions, I believe both of those are very teamwork oriented. Being able to identify a cocktail prescription and bringing it up to the pharmacist, like, I'm not for sure, but I think this could possibly a fraud prescription. And a good pharmacist would adhere to their technician and take a look and do their detailed calls to the doctors and see what is actually going on. So trust and teamwork, I feel, is what helps during those situations.
Yeah, that is exactly it. Trust, teamwork. And I loved what you said, Giselle, like that empathy for the patient. And, you might have a lazy day, but, you never know what they're going through. And that's how I kind of go through my daily, tasks and, trying to push my, team, my techs, and everybody that I'm working with to like be the best is to just, I think of these patients as my family. I want to treat them as they would want to be treated, and vice versa. Like if I had my mom's going to the pharmacy, I would want that pharmacist to do anything that they could and excel and be their best for my mom, you know? So I think the same when I talk to my patients, even if it's a recommendation for, you know, OTC something, it's like, well, let me take the time. Like, I'll go out of the pharmacy. Let me go show you where it is. And you just care. And then prescription fraud and, you know, other responsibilities, like Alexis said, it's teamwork. It's trusting your techs, it's having them trust you. It's full circle.
Thank you. Giselle, did you have anything you wanted to add as well?
Yeah, and I think it could be, you know, important if, let's say, you're in a really high volume retail setting is where I've seen the most high volume with like the drive-through, and then there's people coming up to the front. It was a little crazy. I went to one and I was super overwhelmed because mine was very small. I went to a really busy Walgreens and I noticed, like, you know, there was one particular pharmacy tech who was answering the drive-through, but she seemed very like burnt out. You could tell in her voice that she didn't want to be talking to them, you know. And I think that feeling that way, you know, you kind of have to catch yourself, and maybe you can be like, hey, yeah, I can hear myself, you know, I'm not giving great customer service. Can we switch? Or, you know, can I be moved somewhere else? And just kind of realizing that maybe, or if you're starting to feel too much and you're losing count, and, you know, maybe be like, hey, can we switch? And I think realizing that and working as a team, everybody helping each other, that could be something really cool to kind of just realize and switch around.
Yeah, that's a great point, because, you know, just keeping in mind not everybody is feeling super friendly all the time, 100% of the time. So that's when you can rely on your team and be like, let's take a break, let's shuffle things around. I like that. I think that's a good perspective to have in any job, and definitely in a very customer oriented role like pharmacy tech or pharmacist.
I worked at a Chick-fil-A for my first job, so I definitely had to like catch myself and realize everybody knows Chick-fil-A is known for being nice. So I would catch myself like on a bad day and be like, hey, let's switch because I'm not doing well today.
Yeah. Yeah, they are very well known for their customer service. That's a really good point. Well, it sounds like you definitely have that background, then that's great. Well, that closes out the questions that I have prepared. So I wanted to take some time now to do a Q&A. And full disclosure, I had hoped we could do breakout rooms, but Zoom does not seem to be working with me today, so I apologize. So I wanted to take about 5 minutes to answer some audience questions that have come up. I see that there's 2 questions in the Q&A box right now, so I can go ahead and read those off to the panel. And then for the rest of you, if you have any other questions that you want to drop into the Q&A box, that would be great, and we can kind of answer some of those in the next few minutes. So I'll get started. From Ileana, what kind of hands-on activities did you do while studying? And what are the job responsibilities of a pharmacist? I think that might have been answered a little bit earlier, but if you could all talk about some of the hands-on activities and how it was helpful to get you prepared for your careers, that would be great.
Yeah, there's a lot that you do in school. They called them appies or ippies. Working with faux patients, I guess you can call them. They weren't actually patients, but you would go in as a pharmacist, and like throughout your 4 years, your first 2 years, you're doing ippies and you're doing blood pressure and doing like faux exams. You're getting comfortable with job duties of the pharmacist, like we kind of talked about. You know, just they'll get you prepared. They'll make you feel like you're ready once you graduate. And then once you are, especially as an intern, your 3rd and 4th years, you know, you're in the pharmacy, you're hands-on, you're doing what the pharmacist is doing. And then they're, you know, whoever your preceptor is, you know, on your back end and making sure you're saying the right things and doing the right things, asking you questions. And if you have a good preceptor, which most people do, that you'll feel comfortable. You ask questions if you don't know things. He'll see how let me see you counsel this patient on this medication. And so you do a lot of that in school, like, counseling, getting ready for these medications, being educated on these medications. So yeah, you'll feel good.
Great, thank you. So it sounds like a lot of simulation, a lot of experience in the field to get you ready for it. Yeah. And Alexis, Giselle, are there some clinical aspects of your programs that kind of prepare students for the real world?
Yeah, for sure. There was a lot of hands-on when we went to each pharmacy. The pharmacist was there, just to make sure that, we were, counting the pills correctly in the retail setting, checking for the right medication. Sometimes, the first couple weeks I would grab the right medication, but it would be the wrong manufacturer. So the NDCs wouldn't match. So then I'd have to run back. And so it was a good learning experience to kind of recheck for that stuff. And in the hospital setting, I got to just follow around a lot of techs, see how they refilled the ADM machines. I got to have some experience in the IV room after being certified with the ACC program. They certify you in sterile and non-sterile compounding. So that really helped a lot. And yeah, chemo as well. You got to be in the chemo IV room. So it's a lot of very different experiences, but it's cool that pharmacy tech is such a broad career where you can have, retail setting, go to the retail setting, I want to change a pace. You can go to the hospital. So it's really cool to have that flexibility in a job.
I would say the same thing. My school prepared me. I did a 2-year program, so the last year was very hands-on. We did IV, non-sterile compounding. We made our own. We learned how to make suppositories in our classroom, how to put on PPE. It was very hands-on. Our program is very much the same. Instead of doing it in 10 years, our program do it in 9 months. It's a lot less. I paid like $35,000 for my education, while our program does about $10,500, and that supplies everything: textbooks, scrubs, both national certifications, because we want to make sure that not only are you Texas IV certified, but you're nationally PTCB certified as well. So our technicians will be sitting for the regular PTCB exam as well with the IV aseptic sterilization compounding certification for PTCB.
Great. Thank you all so much for that great perspective. So let's go through the next couple questions. We have 4 more, so I'll try to get to as many as I can. So for the whole panel, what is your favorite part of being a pharmacist or a pharmacy tech?
I'm gonna have to say really is just helping the patients is my most favorite thing. Just knowing that my medication is literally the main ingredient to either save a life or in compounding, there's a saying that we like to say is there's a thin line between a remedy and a poison. So just knowing that just makes me feel so, I don't know, confident, like a scientist, like I'm helping a patient. And then as far as my favorite part of being a pharmacy tech, besides helping people, at least for me, it's definitely compounding. It makes me feel like a mad scientist, Breaking Bad type thing. That's my favorite part of being a technician.
Great, thank you.
Man, I can't think of like one specific thing. Like Alexis said, the main thing is always helping patients. I feel like healthcare is just if you're interested in healthcare, you want to help people. So I'd say that's like my main thing as well, like helping patients. I'd say I don't know my favorite one thing, but I would say the hospital setting is somewhere that you can really see like directly how things affect your patient. Or you can see like, for instance, I would go to the STICU, which is the shock trauma intensive care unit, and just kind of seeing how um, in a bad condition they are, and thinking, wow, like these compounds are helping, ease his pain. I can't imagine, how much pain he must be in, or, just having that empathy, like you just don't know what people are going through, and thinking that, you're helping, but you're helping kind of behind the scenes, but then knowing that you're helping so much, it's just, it's a great feeling.
Yeah, I agree. I mean, like Giselle said, if you are in healthcare, then you probably like to help people. um, yeah, I think my favorite part of being the specific pharmacist, I get to literally interact with my patients, even though it might be like for 5 minutes, because I, have to get all these vaccines done. But like just getting to feel like some people like don't even want to leave. They just want to sit there and talk to me. And I'm like, oh, I wish I could sit and talk to you, but I can't. But, and they have to wait the 15 minutes afterwards. And so I get to chat with them after that. But some people haven't been out of their house for a year plus. And, I have some ladies, men, they're just like, oh, I'm just happy I get to see someone and talk to somebody. And so just the feeling of helping and being able to get that human interaction with, it might be a stranger, but not for that moment. That's the best thing.
Great. Thank you so much for that. In the interest of time, I'll just select one more question for now. So Caddy was asking, I guess on the flip side, what's the worst experience you've had in the field? And if you can't think of a single event, maybe what is a challenge that, what are some of the challenges that you run into as a pharmacist or pharmacy tech?
I guess I have a story. I worked at Walmart during my first year as a pharmacy tech trainee. And I would say something that's really hard is that hits the pharmacy that you see, especially being in the front lines, is addiction. And I had an older gentleman try to bring in a prescription for a fentanyl patch that was a too soon early refill. And I had to inform him that I couldn't fill it. The insurance wasn't going to pay for it. And my pharmacist was not going to as well let him pay cash for it. It was going to be when he was due for that prescription. The customer got upset and he was in a wheelchair. And he sure got up from that wheelchair and tried to go over the counter to bite me because I wouldn't give him the fentanyl patches. Keep in mind, this older gentleman didn't have teeth, so he definitely tried to gum me to death. Being in that situation, being responsive instead of reacting was definitely a soft skill that I had to learn very quickly. And my pharmacist definitely had my back during that situation. So that was an instance that I found very difficult to handle as a pharmacy technician. And I got better at it, but it is a situation that most of my colleagues as pharmacy technicians in different fields definitely see on a daily basis, but more so in the retail field since you're in the front lines.
Thank you for sharing. And it sounds like your trust and teamwork really helped you and supported you in that experience, your pharmacist that you worked with. Great. Stephanie, Giselle, do you all have anything you'd like to share before we move on to our next section?
The worst, I don't think anything gets worse than someone trying to bite you. mainly probably people like yelling, just being upset, not getting, whatever they came there for. So, I don't do well with that. So I just tend to not speak unless, there's a need for me to speak. But, techs y'all are so good at that. Y'all have it handled because y'all keep y'all's cool, and it's rare. And then, as a pharmacist, I'm just going to have your back, because anyone that's coming into pharmacy that's acting crazy, you just say that they're crazy. You just let them, just calm them down as much as you can. And, we're here to do a job as well,
I think a lot of the times too with that, when patients are angry, it's probably the cherry on top of a bad day and they're just taking it out on us, so you kind of just have to bite your tongue a little bit and let it happen. I'd say a challenge as a pharmacy tech, for me anyway, was making sure to be accurate. And just, we have the pharmacist to double check our work for that. But I think accuracy at first is key, because, pharmacists might have a long day and it's like, oh, just check real quick. And so I think being accurate as a tech is like super key. And I think that was challenging for me at first.
Great, thank you. All right, so let's move on to our summer updates. Ashley King, who's our Director of Healthcare Partnerships, reached out that she has an update, and I will open the floor if anybody else has any updates on any great summer programming that is healthcare related, so we can tell all the students and educators about all these opportunities.
Sure. So thanks, Leslie. I just wanted to give everyone a quick update and say thank you to our panelists. You all did a great job. I talked to the healthcare industry partners on a weekly basis, and in the past 2 months, I think the topic of pharmacy tech has come up in every one of our conversations. And so I just want to encourage any high school students or educators out there that this is a very in-demand career right now, and they are hiring like crazy. So if you have students that aren't really sure what direction they're wanting to go, or they're getting ready to graduate and aren't sure what direction they want to go in, this would be a great career path for them. Also, I know a lot of the high schools and CTE programs had offered pharmacy tech certification programs at the high school level in the past. I know that several of you got rid of them, thinking, a lot of that in the talk that it was going to go electronic and that they were going to have machines. It's not as many pharmacy techs. That is no longer the case. Like, I think they tried it and they quickly found out that it did not work. And so those programs are still really, really necessary. And so if any of you are interested in, setting up another health science program with a pharmacy tech certification, please to reach out to me. I am happy to make connections to our school partners that offer those. So please feel free to reach out. I did also hear back from Ascension Seton this week that they will be offering high school clinical placements. So yay, everyone's very excited about that. I am still waiting to hear back about St. David's, but Ascension is planning to host those clinicals. Did want to let all of you know, so you can let your students know over the summer, that vaccinations, full vaccinations, will be required in order to do any type of clinical rotation at the hospital level. So did want to pass on that information. I will send out an email to the group as well. And then as soon as I hear from St. David's about their status, I'll pass that information along as well. So very exciting though. Glad to be getting back to some semblance of normal here in the Austin area. Leslie, I didn't know if you have it on another slide, but I know that Ascension Seton is also offering their health career summer camp, and I believe a hybrid program. So I don't know if that's on one of the slides to come, but I want to let everybody know that that's another opportunity for students if they're interested in it this summer.
No, I don't have it on a slide, but I was going to send a link out to the group after the fact. But yes, great news. Seton will be offering its summer camp, and I can share a link to its website where it has the list of dates and more information about their program. So Ashley, thank you so much for bringing that up.
Thanks, Leslie.
Yeah. And then we had a hand, let's see, I will allow the attendee who has a question to talk. So if you have any announcements, please feel free to mention them.
Hi, good morning. This is Dr. Jerica Thomas Hockaday. I don't have the, I'm not sure how to do the video access, but that's okay. I am the Director of Education at Central Texas Allied Health Institute. I just wanted to let everyone know that we will be enrolling for our pharmacy tech program for a September start. So if anyone is interested, Alexis gave a great presentation and we're very proud of the work that she's doing in our pharmacy tech program. But we have one enrollment coming up in September if anyone is interested. That's all. Thank you.
Of course. Thank you for that announcement. That's great. And that actually leads me to my next slide, because I put some resources on the slide that pertain to the programs that our panelists went through today. I also included the University of Texas College of Pharmacy. I'm sorry, Stephanie, I know UT and A&M are rivals, but I wanted to include a local pharmacy here in the Austin area as well. Yeah, you can check out all of the different links here, and I will share this PowerPoint after the fact with the group so you can dig deeper into some of the resources that we've shared today in this presentation. I also wanted to put Workforce Solutions has a website, climbtheladderctx.com, that allows you to explore different careers. Pharmacy tech, as I mentioned, is one of our target occupations, and so we do have some resources for pharmacy tech on that website, so for you to look at.